Okay, let's jump right into this explainer. Today, we're unpacking something that is deeply confusing and honestly pretty alarming for a lot of parents. We're talking about that complex, heavy medical jargon you might find in your hospital discharge papers weeks after a traumatic birth. You bring your newborn home, you're expecting just joy and relief, but instead, you're looking at records filled with terrifying terms like Category III Fetal Heart Rate Tracing or severe intrapartum asphyxia. What does all that actually mean? Well, today, we're going to decode this exact terminology using the very clinical guidelines that doctors themselves rely on.
Now, check out this stark contrast between the comforting words you might have heard in the delivery room versus the frightening clinical reality that gets documented in your records later on. During labor, maybe someone told you something super reassuring, like, hey, the baby's just getting a bit tired, or delivery became a little urgent, but hey, everything worked out. But then you glance at the discharge summary and see these incredibly severe clinical terms. It creates this massive, unsettling gap, right? Well, we're going to bridge that gap today.
To help demystify these records, we put together a clear roadmap. We're going to cover the hidden delivery room reality, decode those fetal tracing categories, explore the emergency standard of care, look at the consequences of delayed intervention, tackle common hospital defenses, and finally, outline some crucial steps for families.
Let's kick things off with Section 1, the hidden delivery room reality, and bridging that gap.
So in a busy hospital environment, there's frequently this massive disconnect between the real-time clinical data the medical staff is actually seeing on their monitors and what they quickly tell parents at the bedside. When a child later starts showing signs of oxygen deprivation, like low muscle tone, developmental delays, or even seizures, those brief delivery room explanations that the baby was just tired simply do not add up anymore. And honestly, this disconnect is exactly why understanding your medical records is absolutely crucial.
Moving right along to Section 2, decoding fetal tracing categories and those critical warning signs.
To really understand these warning signs, we first need to translate some of that intimidating terminology used for electronic fetal monitoring, which is what continuously tracks the mother's contractions and the baby's heart rate. The absolute most crucial point here is that Category 3 is not just some casual label or a minor blip on a screen. According to the American College of Obstetricians and Gynecologists, it represents an active, critical obstetrical emergency. If you see this on a chart, it means the fetus is experiencing severe oxygen deprivation or hypoxia, along with progressive metabolic acid accumulation. It basically shows an absent baseline variability in the heart rate paired with highly dangerous patterns. Simply put, it is a glaring sign of severe oxygen starvation.
Medical guidelines establish a very clear escalation of severity here. Category 1 is perfectly normal. The baby's well oxygenated, heart rate is a healthy 110 to 160 beats per minute. Everything is fine. Then you have Category 2, which is an indeterminate warning sign. It requires constant vigilance because the heart rate patterns are irregular. It's kind of a gray area. But Category 3, that is entirely abnormal. It is the critical emergency phase where immediate clinical intervention isn't just suggested, it's absolutely mandatory.
Which brings us to Section 3, the emergency standard of care and the required actions.
When that emergency hits, there are 4 mandatory simultaneous steps of what's called intrauterine resuscitation. First, they've got to reposition the mother to her left lateral side to take pressure off major blood vessels. Second, administer a rapid IV fluid bolus of 500 to 1,000 milliliters to boost blood flow. Third, provide high-flow oxygen to the mother at 8 to 10 liters per minute. And fourth, they must instantly discontinue any uterine stimulants like Pitocin, which drive contractions and can literally suffocate the baby if they happen way too fast. These steps are all specifically designed to maximize blood flow and get oxygen to the fetus immediately.
But here is the stark reality. Intrauterine resuscitation only buys crucial minutes. It's a temporary bridge, not a permanent fix. In the obstetrical world, there's a saying, time is brain. If that fetal heart rate tracing doesn't improve almost immediately after those 4 steps, the standard of care dictates an expedited emergency delivery, which usually means a C-section. Every minute of delay while the baby remains in Category 3 allows oxygen depletion to worsen, metabolic acidosis to build up, and tragically, it allows brain cells to die.
Let's look at Section 4, consequences of delayed intervention and the lasting impacts.
If you happen to see a note about severe intrapartum asphyxia in the discharge papers, it's usually pointing to a very specific, devastating sequence of long-term conditions. That prolonged lack of oxygen can cause hypoxic ischemic encephalopathy, or HIE, which is a severe brain injury.
It can damage motor control centers, leading to cerebral palsy. It can even trigger severe fetal acidemia and multi-organ failure. And sadly, you'll often see this reflected right at birth through consistently low APGAR scores, usually hovering dangerously low between 0 and 3. The medical records will also frequently have objective, hard data to prove this oxygen starvation actually happened. For instance, an umbilical arterial blood gas pH value of less than 7.00 at birth. This is not a subjective guess made by a doctor. It's a stark, verifiable, timestamp laboratory indicator of severe fetal acidemia and profound oxygen deprivation that was occurring right up to the delivery. Moving to Section 5, Overcoming Common Hospital Defenses. Let's separate fact from fiction.
Now, when families start asking hard questions, the first major argument they usually hear is the sudden event defense. Hospitals frequently claim that the abnormality, that Category III tracing, was just this completely unpredictable, sudden catastrophe that absolutely no medical team could have anticipated or prevented. They try to frame it like a lightning strike out of nowhere.
However, a close audit of the electronic fetal monitoring records very often reveals the exact opposite. Now, sure, sudden catastrophes do exist, but the vast majority of fetal distress cases actually develop progressively over hours. The records often show a steadily worsening situation, like a baby spending extended periods in the deteriorating Category II state with repetitive decelerations. The clinical reality is that the team often just failed to act on these earlier, incredibly clear warning signs before the whole situation finally collapsed into a Category III emergency.
Another incredibly common defense you'll hear is that the medical team was actively managing the situation. They'll say, well, we were trying conservative measures, giving fluids and oxygen, and we were just waiting to give the baby time to recover. And honestly, that sounds perfectly reasonable on the surface, doesn't it?
But here's the catch. That passive waiting actually violates basic obstetrical standards. Intrauterine resuscitation is meant to stabilize the fetus while simultaneously mobilizing the surgical team and prepping the operating room. It is absolutely never a justification for passive waiting. Using resuscitation efforts as an excuse for prolonged delays while just staring at an unresolving Category III monitoring strip is a crystal clear breach of the standard of care.
Finally, defense lawyers love to cite medical literature claiming that electronic fetal monitoring has a high false positive rate. They're going to argue that just because a tracing looked bad on a monitor, it doesn't definitively prove that medical negligence is what caused the child's neurological injury.
But guess what? The clinical guidelines offer a direct rebuttal to that exact argument. ACOG guidelines explicitly single out Category III tracings as uniquely predictive of severe hypoxia. When you take that prolonged Category III tracing and you pair it with objective physical evidence at birth, like an APGAR score of 2 or that umbilical pH under 7.00 we mentioned earlier, the whole false positive argument completely falls apart. It suddenly becomes objective, time-stamped evidence of ongoing fetal distress and delayed intervention.
Let's wrap up with Section 6, Crucial Steps for Families and Taking Action.
If your discharge papers note abnormal fetal monitoring, taking these 3 proactive steps is absolutely essential. Number 1, you must secure your complete medical records, and specifically, the raw EFM telemetry strips. Number 2, obtain independent medical and neurological evaluations for your child, and that includes getting early intervention specialists on board. And number 3, consult an experienced birth injury attorney who has the actual clinical resources to uncover the truth hidden deep within those complex records.
I really want to highlight something incredibly important about that first step. Standard medical record requests often just yield written notes, but they completely omit the continuous graphic fetal monitoring strips. So you can't just ask for the chart. You have to specifically demand the raw digital files exported from their specialized archiving software. These are programs with names like PeriWatch, GE Centricity, or TraceMaster. Without these exact digital files, you're missing the real-time window into your baby's oxygen levels during labor.
As you review your own experience against these strict medical standards, you are left with a really heavy but absolutely vital question to ask yourself. If your child is suffering from a birth injury, was it truly an unavoidable sudden tragedy, or does the data show it was the result of ignored warning signs where immediate action could have literally changed your family's entire future? Getting those raw records and demanding the truth isn't just your right, it is the very first step to finding out.